Good afternoon or morning, depending on where you are. Welcome to Fibromyalgia Association Canada's Fresh Start September Roundtable. I'm Trudy Flynn, Chair of the Board of Directors of Fibromyalgia Association Canada. I'm having a hard time with that today, or FAC as we like to call it. I'm going to keep my comments brief so we can get right to the presentation. I would like to acknowledge that we are on the traditional and unceded territory of Indigenous peoples across Canada, including First Nation, Métis, and Inuit. We honor their enduring connection to the land and are committed to fostering respectful and meaningful relationships with all Indigenous communities. I acknowledge and give thanks to the land on which we live, work, and play, to the people who have cared for it. I am speaking to you from Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people in Nova Scotia. We are all treaty people. So first I'm going to introduce the panel. Tyler Dillman is a physiotherapist and owner of One-to-One Wellness. Tyler's commitment as a healthcare professional is to create a safe environment for individuals to learn how to integrate healthy lifestyle practices that enhance quality of life and increase participation in meaningful activities. Tyler is a graduate of Dalhousie University's Master's in Science in Physiotherapy program and has a Bachelor of Science in Psychology from Mount Allison University and a Bachelor of Kinesiology from Acadia University. With interest in pain science, behavior change, therapeutic relationship, and chronic pain, Tyler's whole personal philosophy to patient care is based on the understanding an individual's health is influenced by the complex interaction amongst many biopsychosocial factors. Through listening and validating patient experiences, Tyler aims to create successful, unique, and meaningful treatment plans to help optimize an individual's health. When not at work, Tyler can be found spending time with his wife and two sons, exploring hiking trails and discussing fantasy sports with his friends. Dr. Andrea Furlan is a physiatrist and pain specialist at the Toronto Rehab. She is also a scientist at KITE and the Institute for Work and Health. She is a professor of medicine at the University of Toronto, and in her spare time, she posts videos on her YouTube channel. Dr. Andrea Furlan is on a mission to help control chronic pain sufferers restore their ability to live a fulfilling and happy life. She has recently re-released a journal to go with her first book, 8 Steps to Conquer Chronic Pain. And she has been a guest to many podcasts, radio, magazines, and blogs. She is passionate about teaching healthcare professionals about how to properly and effectively help people with chronic pain and fibromyalgia. She is the chair of Project ECHO, Chronic Pain and Opioid Stewardship. It is funded by the Ontario Ministry of Health program that mentors healthcare professionals in rural, remote, and underserved areas of Ontario, and has recently been awarded Health Canada and a CIHR grant to expand and study Project ECHO chronic pain across Canada. So let's move on to FAC's second roundtable discussion. So the objective of this roundtable is to explore self-management and how people with fibromyalgia can use this time of year to reset themselves and look at some self-management tools to get them through what sometimes can be difficult times, the fall and the winter for people with fibromyalgia. So I'm just going to ask both of you. I have some questions for both of you, and then I'll ask individual questions. But September often feels like a natural fresh start. So from your perspective, what does a fresh start look like for someone living with fibromyalgia who wants to prioritize self-care and self-management? And if you would answer first, Tyler, that would be great.
Sure. Thank you so much, Trudy, and thank you for inviting me to be back here, and thank you to the Fibromyalgia Association of Canada and everything that you're doing to create such a supportive network for everyone. So certainly see it on my end, the value that you're bringing to many patients, and just want to thank you for all that you're doing. So a fresh start. And I think from the context of somebody living with fibromyalgia, uh, it's recognizing some of the challenges that can come with the summer, whether it be the heat, out of it, maybe potentially would be considered a normal routine, or a more social interaction or less social interaction. Things that can just uh, drain our energy, so to speak, and elevate our pain. And so, a fresh start is potentially just creating kind of small, actionable steps to support pacing and consistency. Maybe from a physio perspective, it's how do we reestablish a gentle daily movement routine and restorative practices, maybe like stretching, relaxation. Maybe it's planning weeks again, just getting back into some of those routines and habits, and having those tools that work, getting those back into our lives again. So from my perspective, that would be kind of the fresh start of that September can bring.
Andrea?
Yeah, and again, thank you so much for inviting me to be here. When I come to these meetings, I learn more than I teach. I just learned something from Tyler right now. That's great. I agree with everything he said. And then I was thinking, what can I add to that? So one thing that I'd like to add is September is back to school for a lot of people, and for people with fibromyalgia as well. So if you think about something, what are you going to learn and make your curriculum for this year? Are you going to read a new book about chronic pain, about fibromyalgia, about mental health, about anxiety, about depression, about self-improvement, a spiritual book? Or are you going to do a course? Are you going to learn something about your condition? So think about back to school. It's like September, say, okay, uh, when you were a child, September is the date, the month that you buy new materials for school. You buy a new backpack and coloring pencils. What are you going to buy this year? Purchase, sign up for a course, sign up for a peer group, peer-led group. So what are you going to learn this year that will help your journey to conquer fibromyalgia? And that's what I'd like for you to think about a new start.
Thank you. I don't think I thought of it that way at all, actually. Um, when I had kids in school, that's what it always represented to me. And it's funny though, because even though I no longer have kids in school, I still get that urge to make a fresh start in September. So yeah, it seems deeply ingrained, right? So many people, though, feel overwhelmed, especially those of us with fibromyalgia, by long to-do lists, especially during seasonal transitions when you're going from summer to fall, since yesterday was the first day of fall. What are some realistic first steps that people can take to actually set themselves up for success instead of, I have a really bad habit of making this long to-do list and then I look at it even at the end of the month and I think, I, like I feel bad because I didn't get this long to-do list done, right? So how can you help people with set realistic goals? And first steps. What are the first steps? Tyler?
Sure, yeah. Um, and that's a great question. It's a great question all around, and something that we always need to consider, because if these lists get too long and they're feeling like to-dos, then it can become very overwhelming very quickly. And often can lead to maybe not doing nothing at all, or prioritizing things that maybe are not of like a high priority item for the individual or for ourselves. So one of the things that I usually recommend is from like a goal setting type of lens, and an exercise that I would take some people through would be through the chronic pain values inventory. And what that does is it helps people reflect on what's really important to them. Like what is a high value item to them, and then we can set some goals around that. And that could, from my perspective, whether it be it, as a physiotherapist, I'd be looking at the physical functioning aspect, but maybe that's not the best place to start. Maybe that's not a high value item for the individual. And so what I would say is start with something that's really of high value, right? Whether it's social, maybe it's work, it's family, it's learning, and prioritize that, right? And then after that, you can start to maybe add in some of these other items that maybe not have as high value, but let's maybe pick something where we can feel that we're going to be most likely to be successful with first. Because the list can be endless when you're adding in the things we must do in life, day to day, the appointments that come, that's the all of the potential exercises that we're supposed to do, and how we're supposed to eat, and all of these types of things can be really overwhelming. So I think the takeaway from there would be, pick something with high value and that we feel that we're going to be successful with, and that we can start small. It doesn't have to be all or nothing.
Great, Andrea.
Yeah, I learn a lot from my patients when we talk about this, right? Because I when I ask them to prioritize and to set up their goals and where they're going to start changing, they they tell me, they usually say, I start with the most important things. And I start with what's really I need to do, where I must do, and those are my priorities, and start with them. And then they leave very little time in their days and their weeks to do the things they enjoy, or they consider secondary because their energy is down. And so you mentioned that I wrote the second book, and if you allow me, I'd like just to mention one of the exercises that I did in this book, because the book is about, it's a daily reflection journal. I don't know if you can see this because of it's a daily reflection journal. So it has 90 exercises. Each exercise is designed to help the person to just remove my background here. So it's for them to write things. And on day 70, it's exactly this. I asked them to think about one lifestyle change that they want to master, that they can, think about it. So the list here, and I suggest, think about, are you going to prioritize and invest time on exercise, sleep, stress management, smoking cessation, alcohol cessation, nutrition, mindfulness, or socialization, getting social? So I don't want them to do all of this at the same time. And then I ask them to write about what they're going to do and reflect on that, because it's overwhelming to try to do all at the same time. But I want them to, okay, pick one. And I had a patient this week, and she chose socialization because she said, I'm so isolated. I don't have anyone. I don't have family. I don't have friends. And I'm going to focus on that. This will be my next homework, because we know pain is a biopsychosocial event in our body. And if you neglect that part, so for each person is different. Another patient of mine, she's doing everything, sleep, exercise, she's doing amazing. She has fibromyalgia, she's doing amazingly well, but she's still smoking a pack of cigarettes a day. So last time that we met, that's what she's going to work now. And she met with our pharmacist in the team, and we gave her the resources. We hope she will be able to accomplish that. So choose one thing that is important.
Okay, I'll try that. So Self-management, though, can mean different things to different people. How do you define self-management when it comes to people who live with fibromyalgia? I'll start with you, Andrea.
Yeah, this I can't say enough about self-management because it is, I would say, of all my patients' experience that I've seen over this, 31 years that I help people with chronic pain, the best successful, the most successful stories, the patients that are really doing well are the ones who are self-managing. They don't need me. That's basically, I think, what me and Tyler, we want. We want them to be independent of us. What this means is that, first of all, they know what they have. They know what fibromyalgia is, and they have the tools, and they use the tools, and they can control their symptoms. They are in control. The symptoms are not controlling them. This is key. Of all my patients who are doing very, very well, it's because they're self-managing. So they're not dependent on someone doing an injection, someone prescribing them these pills, and someone who has to, do the exercises on them. They know what they have to do. They take charge. Yeah, that's essential.
It's good. Tyler?
Yeah, that's a wonderful wonderful answer that I'll probably more echo than anything. It's really about developing the tools and the strategies to reduce the impact of the symptoms on daily life, right? It's not about necessarily eliminating pain altogether, right? It's learning about pacing, learning about the condition, maintaining certain levels of function, right? And uh, through potentially like safe movement and sleep and recovery um, and not always feeling the need for professional help to get through flare ups and those types of things, but also understanding when it's important to reach out for professional help as well. And it's being an active participant in your own care, right? And that comes with a better understanding of what fibromyalgia is, how it impacts you as an individual, um, and being able to implement a lot of those tools and strategies. It's really important, and then as what Dr. Furlan had said there, it starts to put the power back in the patient's hands rather than the power in the fibromyalgia's hands.
Both of your answers give me a lot to think about. So thank you for that. But how can people strike a balance between listening to their bodies and staying active, engaged with the daily life? Because especially when routines all pick up in September, September has to be one of the busiest months, because it's just you haven't done things all summer and now you have to get them all done in September, right? All those meetings you've put off. And so how do you strike that balance between, do you, I mean, you can't just ignore that you're in pain. So, Andrew, what do you think?
Okay, what I'm going to say now might be new to some people, and it might offend some people. So allow me and forgive me, and let me know in the chat if this offends you in any way. But, or what I'm going to say is basically our body lies to us. Our body lies to us. It lies to me, lies to any of you. And the reason that there is a very important reason why the body will lie to you is because it's trying to protect you, protect me. So this is neuroscience, okay? So it's a little deep in the brain. The body will lie in a sense that will say you are fatigued because it wants you to rest. It wants you to avoid situations that knows that it doesn't want you to confront. So it will create symptoms out of no disease. So there's nothing, like it's normal for you to feel fatigued when you have an infection. If your body is fighting a virus, a bacteria, a disease, you just had surgery, it's normal to feel fatigue, is expected. But if you don't have any of those diseases, conditions, and your body is telling you you're fatigued, your body is lying to you. It's a false alarm. It doesn't mean that you're inventing, you're imagining. The fatigue is real, but it's a false signal. The same thing with pain. The brain can create pain out of nothing. Out of nothing. There's no damage. There's no nociception. There is no injury. And the brain will sound the alarm of pain because it wants you to stop doing something. And so the thing is, if you listen to your body, but don't challenge what your body is trying to tell you, you may be confused because you say, I'm feeling fatigued, I'm in pain. So what is the problem? But we know fibromyalgia, it's not like some people have fatigue, dense fatigue, and they have pain all over their body. The pain is real and the fatigue is very real. But what is that the body is trying to tell you, right? So, because if you believe that your body is telling you pain means injury and fatigue means I need to rest, you need to fight, you need to challenge those messages that the brain is telling you. That's what it's controversial because some people say, no, but if I'm fatigued and I'm in pain, I'm going to rest and I can't do anything. I can't. And they have a list of things I can't. And then I spend time with my patients saying, well, you can, it's just that you are saying it's hard for you to do, but actually your body is able to do those things. It's nothing broken. I just examined you and your body is functioning well. It's just that your body is trying to tell you something. So I'll plant this seed here, which is controversial. I know some people fight me with that. When I try to tell these things on social media, they blame me saying, oh, you don't believe my symptoms are real. That's not what I'm saying. The symptoms are very real, but the message that are behind those symptoms is what you need to go deep and try to find what's going on.
Tyler, can you top that?
There will be no fighting back on this one, Dr. Furlan. I have to. I completely agree. And one thing that I guess analogy in a way that I find that can be helpful is rather than the body could be responding as if something is threatening, right? So how do we, without kind of tissue damage or disease or anything like that, it can be, okay, where is the threat that that our body is experiencing, and how do we reduce that threat? And there are certainly some strategies that we would use, right? And we see that from a physical activity perspective, that's one of the gold standards here. How do we get people moving more? How do we get them more physically active and walking or aqua therapy and those types of things? And um, that comes down to a bit of pacing. One thing that I often encourage patients is you'll be potentially, after introducing movement and starting to get going, you will experience pain, right? But we can't rely on that signal to say this was okay or not within in the moment. So giving ourselves a 24-hour or 48-hour period to analyze whether an activity is okay, depending on our response to that activity, right? Because if we have a heightened alarm, we try to engage in an activity or event, we make it this threatening signal of like, whoa, what was that, right? But over time, that may come down, especially if we, again, that biopsychosocial model, if we're taking some of the emotional weight off of that immediate response, we say, okay, I just have to wait and see, right? And 24 hours later, you're coming back down and you're at your baseline level before that activity. Well, that activity is not a write-off, right? That doesn't mean it wasn't safe to do. We may actually have just been nudged that line enough to say, okay, we can make some changes. Let's try that again. And if you're able to repeat that, and you see that the intensity of that initial response, the threat level has gone down. So how do we keep nudging that threat level down when it comes to some of these activities? So a lot of that comes to pacing and patience, and kind of back to the previous question, understanding and learning about what we now know about fibromyalgia and pain in general, um, and kind of starting with the sometimes the question. I love the self-efficacy component of where do you feel like you're confident? How confident are you on a scale of 1 to 10 in your ability to do this, and that it's going to be successful, and however we define success in that moment and what that looks like. Uh, and if it's 7 to 10, or higher, then we say, okay, go for it. There's a high level of confidence. But if it's lower, say it's down in the 6 or the 5, then we don't say, okay, this really important activity is not for me, or not for you. It's okay. What do we have to do to get that to a 7 to try? Because that's less threatening, right? And so that to me would be kind of, how do we start to balance listening to our body and creating an environment of success for the things that I'd say pain and fibromyalgia has started to take from us. And you can use the same principles for fatigue as well.
So it kind of goes back to that mindset matters because, e- e- especially Tyler, what you said about confidence. If you're confident you can do it, you've already set yourself up for success. And if you go into something thinking, I don't think I can do this, chances probably are that you can't, right?
Yeah, I would say confidence and setting kind of realistic expectations,
Yes.
and being um, uh, uh, what's the just um, potentially a little vulnerable with ourselves in that moment of, geez, this isn't where I'm at. This is not where I'm at. And being truly honest with oneself during those times can make or break whether we feel something successful, and we can see confidence grow in a patient's ability.
Thank you. So then, what are some small daily practices, sort of across medical, physical, and mental care that we can use to build up that confidence and make meaningful improvements in our quality of life? Tyler?
Yeah, that's a great point. From one, I would say we kind of have to go back to like where the things are that bring us high value, right? And that would be kind of the starting point that I would typically recommend of, because and we could overwhelm people with saying, okay, we need to do mindfulness, we need to do stretching, we need to do strength training, we need to do walking, we need to do this, we need to work on your sleep, all of these types of things, right? So we want to kind of go back to, okay, what's the high value item for the patient. And often from my perspective, I encourage starting with deep breathing breaks, and then how do we because the breath is fascinating, right? And we're looking at this system that is feeling under threat, and so that's one of the ways that we can really cue kind of a bit more of the calming system that would reduce that level of threat. So if you can start to incorporate that into even 1 or 2 extra times throughout the day, then that's a really great place to start. And then are we able to maybe kind of layer on a little bit of movement with those, and maybe some body check-ins, and if walking and getting outdoors, right? If we can spend some time outdoors, those types of things can be really feel really small at the beginning, but you can start to see them layer up to, especially if we're able to relate them initially to the goals that people have set, and kind of give them the why are we starting to incorporate these into the day-to-day routine.
Andrea?
Yeah, Trudy, this is something that I like to teach my patients a lot. And I like to ask them to reflect, because each person is different and each person will be, the list of what they need to do is very different. And actually this is without wanting, by the way, the book, the title of the second book, You Are Unique and So Is Your Pain, because each person has a different recipe, I would say. And your list would be different from another person's list. And but how do you start? And I like to tell people, start with a blank page of paper or a computer or a blank, screen. Open a document and start writing, start making a list, start making your priorities. Because if you don't document and you just keep them in your mind, tomorrow you'll forget what you just planned today. Make a plan for you. I think if you don't make a plan, it's hard for you to achieve something. And a lot of people like September is a month for you to start something. Start your curriculum. Start a new thing. What do you want to achieve? By the end of August next year, August 2026, you will look back and say, these are the things that I achieved. It will give you a sense of pride. It will give you a sense of accomplishment, will increase your confidence, your self-confidence, and you will be able to self-manage, because you will go back and you say, what am I doing to self-manage? What are the tools that I have in my toolbox? And if you don't create if you don't write, what are the tools? How do you know next time that you need to use it? Where do you go? You need to, I think you need to be more like as a student of your own condition. I don't mean to go crazy and, become an expert, but you do need to learn a little bit about the science of fibromyalgia, because we know so much about fibromyalgia that we did not know. You need to learn and is anyone taking notes today? I see there are a lot of people here and a lot of people will be watching the recording this. Do you have a piece of paper and you're taking notes of what you are learning today? Because if you're not, you're missing an opportunity here. Even if you can get one or two things from today, but put down in a paper. And that's why I wrote the second book. The second book is prompts for you to do the work. It's 90 prompts, and you don't need to do like one every day for 90 days. But you can take because I want my patients to think. I want them to make lists. I want them to reflect what's going on. But if they don't document that, I would forget everything. I don't have a memory of a computer memory in my head. I need to make lists, and my list I always make on my cell phone. Like I have, documents here that if I have a good idea, if I learn something new, or if I hear something I need to learn more, I will take notes and then I'll go back. But I think that's how you can set your goals, and you can go back and read what you wrote and document it. Be a student. Go back to school.
Okay, so this question is just for you, Tyler. So physical activity is often recommended. I recommend it myself. But many people with fibromyalgia, they worry about flare-ups. So how can we reinduce movement safely in September after having a slower summer? How do you get back to the activity?
Yeah, and a very valid question and concern with those living with fibromyalgia, and doing more in physical activity and causing pain, and on the surface it doesn't really make sense, right? I move and have pain. Why would I do this? My body's telling me to stop. But it's the kind of again, one of the messages that I'm hearing is understanding the condition and that threat and that sensitive alarm system that has developed over time. We know that that's not accurate, and so but we do have to respect it, right? And so from a physical activity, often I'm recommending starting with like really low intensity activities, right? We're trying to create success, and trying to just kind of nudge that line of tolerance to that activity, so we see that change. So this can be a bit, maybe some short walks, again, maybe some really gentle stretching, some of the deep breathing, some water-based movement. But often the key is like really gradual exposure, right? Start short durations, slow progression. We want it to start to build up over time. Um, and also kind of back to that point of the monitoring kind of the symptoms over time. Do not determine if that activity was successful kind of in that moment, if you are expecting, if there is pain, right? We're kind of expecting that at the beginning, but what are the others? How fast does it come down, right? What was the recovery time like? What was the overall impact on the day like? Was it a really high impact, or was it a bit more of a low impact? And so kind of understanding those types of things at the beginning as you're introducing can bring down that threat level. But consistency matters. So finding something that we can be consistent with is going to be better in the long run, than trying to find these doing these exercises and stuff that we may not feel successful with. So finding something that we can be consistent with is really big.
Okay. Andrea, for people juggling multiple medical appointments or treatments, what's your advice on simplifying or organizing their medical self-care routines this fall? That's another thing that usually comes up in the fall. You've not had appointments all summer, and now you've got all these appointments to go to.
Yeah, and I think we can't avoid those things. And unfortunately, we in the medical system, we are very strict with our times, and we are not patient-centric. If we were more patient-centric, we would like book our appointments or tests or exams around the patient's schedules, not our schedules, but that's another another topic. I'd say sometimes it can be overwhelming. I have patients that they tell me, you know what, I'm so tired this week. I spent Monday to Friday going to medical appointments, physiotherapy, chiropractors, tests and investigations, and that's all that I did accomplish this week. That's not the best way to for you to spend your time. Like, this is not what we mean by socialization. But we would like to have, at least if you can schedule things, if you're going to the hospital to see the doctor, then do the exams, like the blood tests, x-rays on that same day. So then you don't need to go back twice. Check with your doctor if you go to the same clinic, or like sometimes you go to the family doctor clinic, and then if you can at the same day see the specialist because they come to the family health team, for example. Try to book your appointments and in a time that is best for your, daily activities. I know for a lot of people especially with chronic pain. For me, I start my clinic at 8 a.m. And some patients tell me I can't be here 8 a.m. because it takes me a long time to get up. So, ask if you can have appointments in a time of the day that is best for you. Is it afternoon? Is it right before lunch instead of early morning? Some people are, they are morning people and they prefer early morning. So make that your healthcare team to know what is your best time. And if you need to do some other, leisure activities, like you need to have your socialization, or if you need to work, make sure your team knows, your doctors, your nurses know, Tuesday is the day that I'm working in the office and I can't have any tests, I can't have any appointments on Tuesdays because I don't want to miss work. Make sure that they know and make efforts for no things to interfere with that, what is important for you. I think you can ask. You can, you're not at the mercy of, your healthcare team. You can negotiate, you can ask, talk to the booking staff. tell them your preferences. I believe most people would be willing to accommodate your needs and your appointments because it is very overwhelming, especially when they have comorbidities, like they have to see an ophthalmologist for eye problems, and then a gastroenterologist for GI problems, and then the pain doctor, and then this and that and that. It becomes overwhelming. So create an agenda, a calendar where you try to manage your appointments. And if you need help, some places, hospitals or clinics, they offer a navigator, and a navigator can be a nurse, registered nurse, or an RPN, registered practical nurse, that can help you to navigate your system and your appointments.
Okay. So Tyler, what types of exercises or stretches are especially helpful, especially during busy times of year when people only have a few minutes in their day trying to get their kids organized or themselves organized? What would you recommend?
Yeah, yeah. And it can vary from everyone's own abilities and their tolerance for certain movements at various times, right? So you can be looking at maybe just some gentle shoulder stretches, right? Gentle neck stretches, kind of side to side. Even standing up and doing little turns, little back bends, forward folds, like those are types of things that take our body through a lot of range of motion, right? As long as it feels safe, and it takes us out of our typical position, which for most of us is in sitting for a period of time. So that can go a long way. Again, like I can't say enough about the breathing exercises, right? 2 to 3, maybe 5 diaphragmatic breaths can really help calm the nervous system. And then um, what you can start to do from that is like you can add in a little bit of, as you're taking a breath in, doing a little pelvic tilt, like anterior tilt and posterior tilt, so arching and flattening your back with that to get a little extra movement. Like even 1 minute every couple of hours can make a difference if that's your starting point, right? Again, it doesn't really have to be all or nothing when it comes to movement. It's where are we? Let's start there, and that could be an extra 30 seconds or a minute of movement, whichever feels safe at the beginning.
Thank you. Andrea, are there specific lifestyle adjustments like sleep routines, nutrition, pacing that you see make the biggest difference in your patients with fibromyalgia?
I love this topic. I could be here talking for hours about this. All of the above. Yeah, all of the above. Yes. Actually, there is a new specialty of medicine. I heard about this last year, lifestyle medicine. I don't know if it's going to become a new specialty. Like I'm a physiatrist. That's my specialty that I chose. And people do like residency in lifestyle medicine, but it's becoming a big focus of many physicians. And there are conferences that talk about lifestyle medicine because there is so much evidence about all of this. So, the evidence is much stronger than actually the drugs, the medicines that we prescribe. Amazing, amazing. Yeah, all of the above, Trudy. Sleep is essential. It's essential. We do need to prioritize sleep. We do need to make every effort to treat our sleep disorders. We do need, if a person cannot sleep well, they need a sleep doctor. They need to have a sleep study. And there are some diseases of the sleep, like insomnia is a disease of the sleep. People think, oh, I don't sleep, I have insomnia. I've always been like that. This is me. It's my nature. No, no, it's a disease of the sleep. And it has treatment. Yeah, the other one that you mentioned, I forgot what was the second one. Nutrition.
The nutrition, yes.
Yeah. Oh my God, that is, people neglect nutrition. They think it's not important because everyone eats processed foods and ultra processed food, and it's okay to be overweight. It's okay not to, save money on food. My mother, she taught me, she always said this, don't save money buying good ingredients for cooking and cook at home. I still cook a dinner every day at home because I think my mother ingrained that in my brain. And I buy the best ingredients because she said if you save money on food, you're going to spend on medications, doctors, and hospital bills. And that's true. And some people just neglect, they say, it's too expensive, it takes too much time to cook at home, so they eat fast food or process anything that comes in boxes. If a food comes in a box and you just need to mix with water and your food is ready, that is ultra processed. You do need to cook from raw ingredients. You do need to cook your vegetables and fruits. Go back to what your grandmother used to tell you. They were right. Your grandmother told you, wake up early, go to bed early, and eat raw and cook your meals. They were right. And then quit smoking, and remove alcohol, remove the junk that you put in your body, move your body, have fun with your friends, go out socializing, have a circle of friends, people that you trust, that you can be open, that you can be natural. You don't need to pretend anything. This is so important for our mind. And if your mind is not in a good place, your body will suffer. And again, remember what I told you in the beginning, the body will try to tell you something. And the body sometimes will lie to you because it's trying to give you, maybe the body will say, will create the fatigue. Your brain will then, because your brain is trying to communicate something to you and it's creating that fatigue and pain. And maybe the message is your body needs nutrients and sleep. And your body is just trying to tell it, stop this nonsense. You're putting so much garbage through your mouth and you're sleeping, your sleep is totally deregulated. And just doing those two things, your body will be so happy and then will stop producing those fatigue and pain. Who knows? I have patients that they were able to go from the whole body pain. I have these pain diagrams in my clinic downstairs. Whole body pain, and just by regulating their sleep, the pain went away slowly by slowly because they were sleeping whenever they wanted, waking up whenever they wanted, taking naps whenever they wanted. It was totally disorganized. And I told them, only thing they did was going to bed every night, 7 days a week at the same time. I said, don't put an alarm to wake up. Put an alarm to go to bed every day, 7 days a week, 365 days a year. Go to bed at the same time and don't take naps during the day. By doing this, you are respecting your circadian rhythm and your body will be very thankful to you and will reward you with less symptoms, less fatigue, and a better quality of life. So I can't say enough as I said, I could be here talking for hours, but I'll stop.
Tyler, do you work with your fibromyalgia patients and help them develop long-term personalized self-management plans so that they can work self-management into their lives between appointments with you?
Yeah, that's what any healthcare provider working with fibromyalgia should be striving for, right? Um, uh, from like my perspective in the way that we're developing these treatment plans, it's one, are we setting these really high value, meaningful goals? Have we created a plan that feels like it's going to be successful in the room from, physical activity, physical functioning perspective, um, and are we in agreement of that it does feel like it should be safe and we can make the progressions, and then it's okay, now take it, work on it, right? Let's see. And then come back in a little bit of time. Okay, what worked well, what didn't? Um, what do we need to modify? Because these changes don't happen overnight. There's not a quick fix with this, right? So if often somebody was saying to come see me the week after, right? We're not going to have a good amount of information to say make a change one way or the other. They could be feeling really good, right, for a variety of different factors, or they could be feeling in a flare for a variety of different factors. We don't know if our plan is contributing to that. So and if it is going to be part of their long-term strategies to work, right? Or if maybe kind of down the line and when we see is it okay, well, we didn't really see much change. We weren't maybe able to get it integrated into our day. Maybe there's a lot of other factors. You know what? I don't feel like I'm the right starting person for you here. Maybe we should try another avenue, and then we can continue with these strategies, but maybe revisit coming seeing me to progress these when after you've had these other sessions or other tools that in your tool belt. But this the goal of self-management and developing the skills and tools and strategies is the ultimate goal, um, because that's again where we see people have the most success, right? And they're returning to the things that were taken from them, and they're back to the things that are bringing them joy and feeling successful and more empowered. And that should be the end goal, I think, of most um, healthcare appointments with chronic pain.
So, people with fibromyalgia almost need two plans. So we have a day-to-day plan, and then we have our flare-up plan. So, uh, do you deal with that in physiotherapy? Is that something you deal with, that you have people are going along, but then they go into a flare, and so it all looks different, right, when you're in a flare? And think about that, Andrea,
Yeah.
because I want to ask you that too.
Um, Aspects certainly will look different. And what we know during a flare-up period is we don't want to stop doing everything, right? We want to. We often are looking at how do we help people continue those things. There's kind of like this stoplight analogy, so the green light are the things that we continue to do. The yellows are a bit more cautionary that we could potentially do, in the reds are like we need to stop, right? And so when you're looking and you kind of go through a bit of an exercise around, like we call it like safeties in me and dangers in me, right? Things that make us feel safe, right? Those are the things that we would say, okay, we want to be continuing to do these, whether it's some really like calming music, whether it's some mindfulness and meditation, potentially is there movements and positions that make us feel a little bit better. Maybe there's some people that make us feel really good that we want to have a conversation with. And then on the flip side of that, maybe there's some movements that we don't like very much. When we're flare, there's some television or some noise or busy environments that maybe we shouldn't be in as much. There's some people that maybe that um, uh, we don't necessarily need to engage in conversation with as much. So those are certainly discussions that we can have within our profession. But there would be some where I'd be recommending to have the longer term goals and strategies, maybe with like our occupational therapist or a physician or a psychologist, to say, okay, that they are better at building that tool up than I am. So that's where that kind of interdisciplinary care comes in.
Thank you. So, Andrea, do you do that? Do you have a day-to-day
Yeah.
self-management plan, and then something for when they go into flares, or when we go into flares?
You know what, Trudy, that I wish my answer was yes. But our, cl- our clinic is, we work in a multidisciplinary clinic here. They're wonderful. But I can tell you, and I don't know if this is just, I work at the TAPME clinic, Toronto Academic Pain Medicine Institute, which is the largest pain clinic in downtown Toronto, and we are one of them. And I would say we're not so organized I wish, that's what I said. I wish we had a program that people with fibromyalgia would enter. Everybody would get the same information, a flare-up plan, know about the disease. It's not happening. And I feel so bad about that because I feel responsible that I should help to create this, like a program that people could graduate and have all of this. Some people do it, some people don't, depends on which professional they see. I send a lot of my patients to the FAC website. And then I sit with them and I say, this is the website. I want you to go and indulge in this information. And I remember you had a link in the FAC website with it was an emergency flare-up plan.
Flare kit. Yeah, flare kit.
The kit, yes, yes. So
Yeah.
I love that. So that's why I recommend to my own patients to go there and find the kit. Yeah, so I think someone, is putting some forms there. Because, for us, for the pain clinics and the pain doctors, I have to tell you, the reality is we have the time that we spend with the patients, we are reviewing the lab tests, the MRIs to make sure that they don't have any serious conditions that we are missing. And then we examine them, confirm, and then we see them in follow-up, how adjusting the medications. Like, even for me, I love educating the people that I see in the pain clinic. We don't have a lot of time to spend. And then our multidisciplinary team, they are focused also, the physiotherapist is trying to mobilize them. I don't know if there's any good example of a pain clinic or a multidisciplinary team that is doing this really well. I'd love to learn how they're doing and graduating the patients. This is what our goal is. The hospital is always pushing us, discharge the patients, discharge, because we have such a wait list of people waiting to enter. They want us to discharge. And sometimes we discharge patients prematurely, for sure, without having all those resources. Yeah, I feel guilty about that. And if anyone has any idea how we can improve that to make it more consistent for everybody. But for sure, when they graduate from our program, when we discharge them, here it is, the FAC, fibrocanada.ca. It's on every prescription that we have for patients with chronic pain, including fibromyalgia.
Well, thank you for that, Andrea. That's awesome, actually. Um, and I think that is maybe that is our responsibility. Sometimes we look at self-management and just how we started this off is maybe that is our responsibility too, that we learn as much as we can and we find out what would work for us in a flare and with the help of FAC we develop our own emergency flare kit. So because what works for one doesn't always work for another. So maybe it is an impossible thing to ask people in the healthcare system because they have to be so individualized, right? So just to wrap it up, I'm going to ask you both, what's one piece of encouragement you'd like to share with people who may feel like they're starting over again this fall in managing their fibromyalgia? Andrea?
Yeah, so one thing that I like to leave with people here is hope. We know a lot more about fibromyalgia today than we knew a year ago, that we knew 10 years ago, or 31 years ago. When I was in medical school, what brought me to chronic pain was one patient with fibromyalgia, and that opened my eyes. People may have pain, chronic pain, and they can be helped. But at that time, 31 years ago, when I graduated from medical school, we knew very little about fibromyalgia, and we were helping people with fibromyalgia. Now we know so much about the function of the pain system, the neuroscience of pain, what is pain, we know the medications, how they work better or not, and the lifestyle. So don't lose your hope. Learn, be a student of your disease. You have to be the expert in fibromyalgia. The Fibromyalgia Association of Canada has the website has a lot of resources. Indulge in their content ask questions and take notes and read. And because the knowledge will be your best friend. The knowledge that you have in your head will be your best resource. I'm not kidding. Medications will not do for you what knowledge can do for you. Okay, so that's I hope you get, hopeful that there is a way for you to live a lot better. There is a way for you to live despite fibromyalgia in your body, live an almost normal life that nobody will notice, and you will have an excellent quality of life. Don't lose your hope. If you're still not there, keep working on this slowly. Don't need to rush, but don't stop your journey. Don't get stagnated. Keep searching and looking and going on this journey forward. You have here a lot of good examples. Trudy is someone who conquered fibromyalgia, and you have so many other people in the Fibromyalgia Association of Canada who are willing to share their experiences with you. They can be like a role model, a coach. This is amazing. You can see another person and say, I want to be like that when I grow up. It's possible. It is possible. Even if if you've just been diagnosed yesterday with fibromyalgia and you know nothing about fibromyalgia, you can be hopeful and conquer this disease until one day that we'll find a cure. I think it's not that far. The science is advancing very quickly. Soon we'll be able to find exactly what is wrong. It's creating all these symptoms. But until that day, there are a lot of things you can do and participate, and knowledge will be your first step. That's all.
Thank you. Tyler?
Yeah, knowledge is power here. Absolutely, 110% agree with Dr. Furlan on that one. And I think it's really important to know that fibromyalgia is not linear, right? And if you are feeling like you're starting over, it does not mean you failed at all, right? Um, like every small step or big step that you're taking is progress. It's working on yourself. It's building strength. It's building resilience, and it's just starting to get back the things that you want to be doing and living the life that you want. Um, and it can be really easy. To feel really negative with these types of things, but give yourself credit for showing up. Give yourself credit for being willing to learn. Give yourself credit for trying, and and uh, if you take some of the tips here today, it will give you a really good starting point. And maybe not if you're open to implementing them, but maybe even just how to even navigate your next conversation with your healthcare team. Hey, I heard this today. What they had mentioned, learning. What should I be learning more about fibromyalgia? They mentioned pacing and prioritizing, and all of that will be really helpful in navigating the next steps and moving from kind of this feeling of starting over to feeling like you're accomplishing something.
So I would like to thank you both so very much for coming. I really enjoy these roundtables. So much information is gained through things like this and from both of you, actually. So thank you very, very much for coming today. Before we stop recording, I'd just like to make two announcements. One is that FAC has a new website. So if you haven't been there in a while, for the people who are here, it has a new website, new look, and always adding information to the website. And FAC has received its charity status. So that is great news. And I just want to thank the people who donated to us when we were not able to issue CRA charity receipts for your income tax. And your belief, in fact, is what kept us going through those 4.5 years. So thank you all who donated. And it is good news for us because hopefully it will enlarge what we can do and extend our reach to the fibromyalgia community. And thank you both for recommending FAC to your patients, and we really appreciate that. So take care, everybody. Thanks for coming.